Hi, everybody. Ian Bremmer here. Yet another coronavirus edition, updating you on what the hell I think is going on in the world. We're going to be in this position, I think, for some time, frankly. A few things I can say. First, some good news. The developed world, the wealthy countries in the world, the governments are all now finally responding with due sense of urgency and emergency. They're not coordinated. Certainly, we've seen nothing really from the G7 and nothing substantive from the virtual G20 meeting that was held this week, though I'm glad it was held. But we are seeing all of the wealthy governments individually inside their countries work really hard to try to ensure that they have the capacity to respond to the exploding number of cases of this global pandemic. And they're doing it in three different ways. First, in terms of the healthcare systems, working to stand those healthcare systems up so they won't get overwhelmed. And frankly, that is the first thing that we need to look at in terms of the next couple of weeks, whether the wealthy world is going to be adequate or not in its response. These responses have been late. And certainly you now have, again, the private sector and the public sector working together, building up as many additional ICU beds, as much supply capacity in acquisition and production of medical equipment, and additional surge medical personnel. This is happening in the US, it's happening in Canada, it's happening across all of Europe and the UK. Unclear that is going to allow us to avoid a Northern Italy type scenario. Dr. Fauci a couple of days ago from the National Institutes of Health said he was hopeful, but all the epidemiologists that we're talking to, all of the critical care doctors are saying they don't feel comfortable. Certainly not in New York, not in Chicago, not in LA, not in Boston, not in Philadelphia, not in New Orleans. In Europe, it's particularly London, Madrid, Catalonia, Barcelona. Those are places that look also like they might be caught out significantly short. We're going to see the answer to that within 2 to 4 weeks. And if we're able to surge adequately and the social distancing and lockdown measures that we now see across all of the developed world where the cases have truly exploded, and we will shortly see in other places. That means across other parts of the United States, over 50% of the country effectively on functional lockdown right now, and over the rest of Europe that will follow the measures that Italy, the UK, France has taken. We'll see within 4 weeks whether that's adequate. And if it is, the caseload will still explode, but the mortality will be dramatically lower by a factor of 80 or 90%. And that's a really big deal, right? Right now, the caseload in the U.S. is higher than anywhere else in the world. Yes, the Chinese lie about their cases, but the U.S. dramatically undertests on balance. You still are looking at a United States with a much more significant outbreak than what the Chinese had at the peak. But the likelihood that you'll see a lot of American deaths is actually looking much lower. Again, the key variable there is, do we get the healthcare system surged adequately in the next few weeks? It's a race against time there. We're also seeing the developed world responding dramatically on the monetary and fiscal side. On the monetary side, it's clearly adequate, in part because the central bankers all are reading from the same script. They're technocrats. They're pretty independent from their governments. They have lots of capacity, and they're reading from the 2008-2009 playbook. We had a financial crisis before. There were regulations to ensure that the banks became more robust. They're working pretty well right now. So that's not my area of concern. On the fiscal policy side, the rich world is doing a lot too. Is it enough? It's enough for now. A $2 trillion stimulus from the U.S. is 10% of American GDP. looking at the fact that the Fed's going to be able to leverage that with additional loans. You're looking at a functional equivalent of $4 trillion, 20% of GDP. That means that it should be enough relief, 20% of GDP, to get you through kind of a fifth of the year. So let's say 2 months, which is really important because the U.S. economy has basically ceased functioning on the supply and demand side as of now, and no one thinks it's coming back in the next 6 weeks, 8 weeks. No one's serious. So as a consequence of that, the fiscal stimulus appears sufficient for that. And the market response, which has been quite positive so far, I think is on the back of that. But every member of Congress I've been talking to in the last week has said that they believe that we will need more stimulus on the back of that 2 months when Senate comes back, end of April, May, June. What kind, how big, we don't know yet. But we've got things like the U.S. postal system that is on the brink of insolvency. That's not going to get any better. A lot of Americans that are going to need more checks, more support, unemployment exploding. Small businesses will need more support. Other major sectors of the economy will need more support. So whether that's another $4 trillion or more than that, I don't know. And of course, the closer we get to the elections, the more challenging it will be for the Americans to do that. But for now, feel good on the fiscal side too. Where then are we worried in the near term, aside from the healthcare systems inside the developed markets? Well, the emerging markets. We worry about the emerging markets because they need the same scale of stimulus, but they don't have the cash. Indian stimulus, right now they're on lockdown. They don't have the capacity to functionally ensure that lockdown is implemented. It's all done state by state. A few states, Punjab, Kerala, Maharashtra, look like they're doing a decent job. Other states, nowhere close. Modi had that problem with demonetization and the rollout. He's going to have a much bigger problem in terms of coronavirus. Plus, 80 to 90% of the Indian economy is the informal economy, which means the only way you get money to people isn't through companies. It has to be direct. But a lot of the money that's given out is going through businesses because they have lobbying power, which means not so effective and nowhere close to the kind of scale you need. So where's the money going to come from? Has to be external. Well, I mean, you're going to need to see the IMF, the international financial institutions, the Americans, the Europeans, others really step up to make that work. I'm skeptical right now. So the potential that emerging markets are going to experience really bigger crises in the next couple months, I think that our attention will eventually turn to them because they're the ones that are going to crash. They don't have the governance resilience. They certainly don't have any coordination. They need the money. They don't have it. The external environment isn't conducive. Turkey is going to be a big problem in that regard. We're starting to see a very steep curve of cases there. The Turks have a real problem with social distancing. It's very different from the Nordics, for example. It's very different from Japan, for example. That cultural feature does actually play in why we see more explosions of cases in Italy and Spain, because just generally in life, people are spending more time in close proximity to each other, large numbers. That is obviously leading to many more cases. That's a problem for Turkey. In the case of Brazil, I've been talking about that for a while. The Brazilian government, the president, has not taken this seriously. He refuses to shut down or call for shutdowns of pieces of the economy, social distancing. Instead, he's developing campaigns to go after the governors that are shutting down the economy. A deeply dangerous thing for him to do that I think he's going to be punished for. Look, if it turns out that the caseload and explosion doesn't actually happen in Brazil and they've kept the economy in decent order, then he'll look like a hero. But I wouldn't make that bet. In fact, I think that Bolsonaro is going to be in an awful lot of trouble going forward. But what this is saying is that a whole bunch of major emerging markets are looking a lot weaker and a lot less capable in responding to the worst crisis of our lifetimes. Final point, U.S.-China. Somewhat better story from U.S.-China, which is that after Trump has been leaning into calling the virus the China virus, and the G7 couldn't even come up with a joint statement because Secretary of State Pompeo was saying it's got to be the Wuhan virus, and no American allies went along with that. So no statement. Trump finally yesterday has a conference call with Xi Jinping. Guess what? He calls it the coronavirus, tweets about it. Guess what? Doesn't call it the China virus, calls it the coronavirus. Is that just because Trump doesn't actually have a willingness to talk honestly to Xi Jinping's face? Is he scared of him? Or is he actually backing away from a Cold War footing? I think it's more the latter than the former. I think President Trump now at 49% approval ratings, a bounce on the back of that $2 trillion plus stimulus that's been passed, a bounce on the back of a lot of Americans feeling fearful, and the fact that outside of Trump, you've got people that are acting like leaders right now, certainly Dr. Fauci, certainly Dr. Birx, certainly even Mike Pence, the vice president, although antipathy to Trump remains very strong among half the population. He feels more comfortable now. He doesn't want the economy to take a bigger dive on the back of him starting a fight with the Chinese, so he's backing away from it. And that's good news. Absolutely, the Chinese, smaller economy, don't want that fight with the Americans either. Xi Jinping feels like he's going to be in better position either way going out of this crisis and doesn't need that. Will it stick? Depends on how Trump's numbers do in 1 month, in 2 months, in 3 months' time as the election gets closer and as it's much harder for the American president to give a good story, particularly because this story is going to shift from numbers to people. A couple weeks ago, none of us knew people that died of coronavirus. Few of us knew people that had it. Now, a lot of us know people that have it. Some of us know people that died. The first person that I know died of coronavirus just 2 days ago. And as that becomes the focus of the story, Trump's lack of human empathy is going to be more challenging for him publicly and on the stage. And it's going to be hard for that to be supplanted or replaced by anybody but the American president. So I still worry quite a bit about the potential that we end up in a much more confrontational stance of the Americans vis-a-vis the Chinese, but we'll see where we get. Anyway, that's my view. I hope everyone is being safe, is avoiding people, and has as enjoyable a weekend as one might, given the context. See you all soon.